everyone. I wanted to thank you for joining us today. My name is Joan Barrett, and I'm the director here at Lakes Area Community Coalition. I'm really excited to have you meet our guest today. This is Rony Foumia. Rony is a volunteer with the coalition. He is our parent sector representative. And in addition to being a parent in the Lakes area, Rony is also a pharmacist by trade. So I'd like to introduce you to Rony.
Thank you so much. It's an honor to be here with you, and I want to thank you as well for all the work that you do in the community. You really inspire a lot of people, and it was ironic. The first time I met you was when Grant, my son, was part of the work that you and your team do. So it's an honor to be here, an honor to talk to you about some very important issues.
Thank you. Thanks so much for your time. So as I mentioned, you're a parent and you are also a pharmacist. Tell me a little bit about your experience in both of those areas.
Well, sure. My children are the love of my life. I've been married for 16 years. I have 3 children, a 14-year-old who just is about to complete her first year in high school, another child that's completed his 7th grade year, and then another child that is going completed 5th year and is going into middle school. So it's probably my most important job and the hardest job that there can be, right? Yeah. As far as professionally, I've been a pharmacist since 1999 here in the state of Michigan. And mostly in the past, since about 2007, I've been managing pharmacies. I've worked for various companies. I've managed over 200 different drugstores in the state of Michigan since 2007. And I was appointed by Governor Schneider in 2017 to the P&T committee, and then reappointed by Governor Whitmer to the same committee. And then I also serve on the Oakland County Executive Board for the Pharmacists Association in that county. So I have a lot of experience in a lot of different areas, and I've been blessed to work with a lot of good people, to be honest. So,
well, we're super glad that you're engaged with the Lakes Coalition. We appreciate you. Rony, right now during the pandemic and people being isolated, staying safe at home, many people we know are struggling with depression and anxiety at this time. Many folks have likely been prescribed antidepressants or anti-anxiety meds. What are some things that people need to know about staying safe while using these medications?
You know, you bring up a very, very good point. Obviously, we're going through some very challenging times, right? There's isolation that's happening. People are lonely and people are scared. People are uncertain about the future. There's financial issues that are happening all around us. So these issues are very, very important to talk about, first of all. I think more so in terms of the safety of these medications, the thing that we got to really understand, first of all, that we got to get over is the stigma that is attached to these medications. So if you're a diabetic, you go to the doctor to get treatment for that issue. If you have high blood pressure, you have no issue going to the doctor to treat that. Those are all accepted things that within society. But it has become an issue of talking openly about mental health issues, and something that we're really trying to get out. It's okay. And there's so many people throughout the country that suffer, that go untreated, to be honest with you. And that's just as dangerous as the issues that we face with the treatment of these meds. The other thing too is just educating people on what these medications are. There's different classes of medications, for example, and you really got to understand that the very first thing that you should do when taking any medication is educate yourself. Just because a health professional prescribes a medication for you doesn't mean that it's all that responsibility is on them. We own that responsibility as parents, as friends and family members, of caring for somebody that is going through depression and anxiety. Educate yourself on what you're taking. I cannot tell you how often I come across people that are taking pills and have no idea what they're for. So that's step one. Step two is understand which medications are considered as needed versus medications that you should take every single day. Okay. With drugs, antidepressants, for example, there are drugs that you have to take daily, and it can take up to 3, 4, 5 weeks for them to even start working. And there are other classes of drugs, such as drugs to treat anxiety, such as benzodiazepines, drugs like Xanax or Valium, things like that, that you a lot of times take on an as-needed basis. So when things are really rough and you're having a lot of anxiety, that's when you would take certain drugs like that. So educating yourself on these medications, on what they do, is important. Also, understanding the side effects. People don't understand that drugs can have side effects. And one of the more common side effects of a lot of these drugs is drowsiness. So you got to be cautious. You don't know until you know how a medication impacts you. Operating machinery or driving is something that you really got to pay attention to. Yeah. The key thing here is everybody reacts differently to medications. We're all individuals, right? So what happens to one person doesn't mean it's going to happen to somebody else. But that's the key thing, the message around what's happening today is let's get over the stigma, first of all. Get the treatment that you need. It's okay to seek treatment. And then educate yourself on what you're taking to safely take these medications.
That's great advice. Thank you. You mentioned some people that may have chronic health conditions like diabetes or heart disease. Many different types of chronic conditions require folks to seek medical treatment, and that's a challenge right now. What challenges in particular do you think folks with chronic medical conditions need to know during COVID-19?
Well, we've heard the message, right? And it's understandable. We need to stay home to be safe. So the unfortunate part of that is that we also see the opposite of that. We see people that probably should get medical treatment that are scared to go to a facility because of the fact that they're scared to contract COVID or to infect other people or just to be around other people. We've heard that message to stay home, to stay safe. First of all, if you need medical treatment, you got to seek treatment. There's options out there to get the help. So if you have a chronic condition, do not go without your medication. Here's the other thing too. There's a ton of executive orders out there right now. There's an executive order that empowers pharmacists, for example, if you're out of your refill for non-controlled medications, it empowers a pharmacist to give up to a 60-day supply if the pharmacist is having a hard time getting a hold of your doctor. Yeah. So there's a lot of different avenues out there. You just got to be able to go and find those avenues.
What advice would you have for patients who would consider accessing telemedicine, telehealth visits? That can be daunting for people who maybe have never done that before. What would you say are best practices or good advice for folks seeking telemedicine?
Sure. Great question. So the thing is, I always tell people too, is prepare. Right? Before you get on that video conferencing with a doctor, take a few minutes and really write down what your thoughts are, write down what you're experiencing so that you have them all in front of you so that you can clearly express what is happening to you. You have to remember, you're talking through a video camera, the doctor's not right there in that, so you need to be able to provide as accurate description of what you're experiencing through that video conferencing. The other thing is be prepared. If you have access to taking your blood pressure, for example, that's great information to provide to your healthcare provider. Another thing is if you're a diabetic, have your sugar numbers ready. You might be asked that level as well. Another thing could be having a pulse oximeter. You can purchase them. They're hard to find right now, unfortunately. But a pulse oximeter, what it does is measures the saturation of oxygen within your blood by simply putting a device on your finger. Okay. It also measures how fast your heart rate is beating as well. So being prepared and being able to provide basic health vital information is very helpful. It's not a requirement by any means, but it's very helpful to accurately get a good picture of what is happening to you during that visit. And again, ask a lot of questions. It's an amazing resource. It really is, because of the fact that you don't have to leave your home. Yeah. You can do it right through your computer system. A majority of insurance companies, to be honest with you, they pay for it as well. So it's something to definitely consider. But basic communications, if you're not comfortable with that, call your doctor. That's the key thing right now is do not shy away from reaching out to your healthcare provider to get the care that you need to make sure that you and your family are healthy.
Rony, as a dad and a parent in the Lakes area, what would you recommend that parents consider at this time to keep their kids safe from prescription drugs, but really any drugs or alcohol?
Great question again. And it really comes down to the way I look at this is, right, people are uncomfortable. Parents can be uncomfortable talking about this at certain ages. So the question comes up is, how young is it too young to start having these dialogue? I started having these discussions with my kids when they were 7, 8, 9, 10 years old. The key, and what breaks my heart, is we come across young adults, teenagers and young adults that are addicted to medication. Nothing is more powerful than educating our youth to prevent them from getting addicted in the first place. That's key with me. Let's prevent people from getting addicted in the first place. If we're talking about opioids, for example, having Narcan out there to save lives in case somebody overdoses is amazing. But let's prevent people from getting to that point. Let's empower people. The key thing is that first discussion, that first point that I mentioned, is having dialogue with our children, building that connection with our children. There's two things that are going to happen here. You could either build that dialogue, or our phones and electronics and iPads will do that for you. And the information that's out there is out of your control. So take charge of that. Have those discussions with your children. Build those relationships. Here's the other thing. It's okay to ask questions about who are your children hanging out with. That's so important. It's okay to question your children on who are these friends that they're around. Friends can be extremely influential in the decisions that our youth make. And it's okay to question them around that. Again, educating them on the dangers of not just prescription drugs, but also illicit drugs. Having those dialogue is so, so very important as well. And then also know the medications that you have at home. Here's the thing. I cannot tell you how often we have grandparents and parents that go in for minor surgeries, right? And the doctor, say, prescribes 30, 40, 50, 60 tablets of a medication, which we're trying to educate on getting away from. And those medications, where do they sit? They sit in a medicine cabinet a lot of times. And we forget all about them. And our children are there. And a friend comes over, or a cousin, or we go to a grandma's house and they're sitting right there. We got to be careful of the access that we provide children as well. When we have medications at home and they're no longer needed, know how to get those medications out of the home. So a lot of people don't realize that for the majority of pills, you can go to your local law enforcement agency, you can call ahead, and majority of cities have this. You can take them back, no questions asked. They'll take them back for you and dispose of those pills for you. So there's other options now. You could buy pre-made packets of where you can deactivate the drugs. You can buy commercially made products to deactivate the drugs. Knowing how to properly dispose of medications is so very important. And I keep coming back to this. Having those daily dialogues is so very important. Becoming active with your children is so important. Here's one last point I will give. Know the signs of addiction, no matter what it is, whether it be alcohol addiction, whether it be opioid addiction. We hear so much about opioids. But unfortunately, as parents, the signs are right there in front of us, and we don't ask the questions. Do you see missing money at home? Are they starting to steal? Are they hanging around friends that they've never hung around before? Are they waiting for messages, anxiously waiting for messages, text messages? Are you seeing physical changes? A lot of times the signs are there, and we need to educate ourselves about looking for those signs and intervening and preventing our children and youth from going down that path.
You bring up so many good points, and I really appreciate it. I want to mention that I really appreciated what you said about disposing of prescription meds appropriately. And we've partnered with the city of Wixom, and in their police lobby is a 24/7 take-back kiosk that anyone, anytime can drop their medication off in the sealed container and the police dispose of it. And that is open right now, although the rest of the city building is closed. It is accessible to the public right now. So that would be a great option.
Yeah, there is. And there's also a lot of pharmacies in the area. They have take-back locations as well, where they'll have the chutes within the pharmacy. Not all pharmacies have them, but they have those as well. So really educating yourself on, educating ourselves on those options is important. And I always say this point, is the fact that there's literally 3 guarantees that I give to parents if we don't intervene. And those guarantees are that your child, if we don't step in soon enough, will eventually become addicted, will eventually overdose, will eventually die from an overdose possibly, or go to jail. Those are different things that could happen to our children if we don't intervene. Here's the other thing too, is let's not wait on laws to protect us. We can throw all the laws in the world at this. We can throw all the money in the world at this. It's not going to solve the problem. We as a society have to own it. And that becomes with amazing people like you. And the work that you do is inspiring because of the fact that we're focusing on education. We're empowering people to make that right decision, because no matter what it is, if it's our child or a family or a loved one, they might come across a situation where they're presented an opportunity to make that choice. That choice could be to use that illicit drug, which they know nothing about, or a prescription drug of somebody else's that they know nothing about, or to empower them and to say, that's probably not the right thing to do. That's our ultimate goal. That is the difference that we can make as a society, is the power of education that's out there. That is how we're going to overcome these type of things.
Rony, I appreciate your work with us. I appreciate your passion as a professional, as an educator, and clearly as a parent. We are very fortunate to have you with our coalition and in our community.
Yeah, as I mentioned, it's an honor. When you had reached out to me to see if I would be interested, I didn't even hesitate. The work that you are doing and the entire team is doing is really inspirational, and we need more of that.
Thank you so much for your time today, and we wish you the very best. I hope your family stays safe and healthy.
You as well. You as well. Thank you again for all that you do. Really appreciate you.
Thank you. And thank you for helping to build a healthy, vibrant, drug-free community with the Lakes Area Community Coalition.